When I was growing up, I changed my mind pretty frequently about what I wanted to do. At one time, I wanted to be a running back for the Alabama football team, which didn't quite pan out. So I started out in chemical engineering, and I was an engineer for several years, and I was working on a project as an engineer with tobacco companies. That was like, if there was one thing that maybe changed my mind and said, you really have to get into something where you're making the world a better place instead of this kind of stuff, that was probably it. It sent me off into medical school. I've always felt sort of an obligation to try to make the world a better place. Not just for the patients, but their families, their loved ones. We had a patient that was about 6 months out from her surgery, and she'd lost a good bit of weight already. And she had a 10-year-old daughter, put her arms around her mom, and she could clasp her hands around her mom. She said, I've never been able to put my arms around my mom and touch my hands together. We see those kinds of changes in people's lives over and over again. It's not just the medical problems, it's all the interactions with their family, just being able to get out and live their lives better.
I first met Dr. Smith early in 2015 when he came to our hospital to just look around, see what our program was about. And from the first time I met him, I just was so happy. As I got to speak with him, I was really pleased that what he did ethically and morally and meticulously.
Been fortunate enough to be able to join an amazing program here that they've built over the many years, and joined also Dr. Kim, who I've known for a long time. He's always going to fight for what's right, and I really admire that, and I'm fortunate to be able to work with someone like that. We feel like we're helping these patients in every area of their lives, and that's really, really rewarding for us. All of us here, not just the surgeons, but everyone who works in this feels that way.
He has very good outcomes, he has very low complication rates, and that impressed me.
He really thinks about, is this the best fit for this person?
He took the time to listen to the patient about their behavior, about their lifestyle, about their health, to pick the surgery that was best for them.
There's not many areas of medicine where you get to see that kind of positive change in people's lives. That makes me feel like I'm doing the right thing here with my life. I'm doing something that makes the world a better place, makes each patient's lives better, makes their families' lives better. Hard to put a price tag on.
To learn if bariatric surgery is right for you, visit obesityinfosession.com.